The cabin of Air Force One hums with a constant low vibration, the sound of engines carrying the President of the United States across the Pacific. Inside the press compartment, reporters lean forward, notebooks open, cameras steady, waiting. The flight is en route to Tokyo, marking the first stop in a wider diplomatic tour across Asia. The atmosphere is steady, but there's anticipation in the air. Rumours have circulated over the past week regarding the president's recent health checkup at Walter Reed, and on board, the president chooses to address it in his own words. Donald Trump stands near the aisle, adjusting his jacket in a familiar manner, the white cabin lights reflecting softly against the polished surfaces around him. When the question comes, he pauses only briefly before responding directly. His tone is assured, his gestures practiced. He answers the press. Yes, I had an MRI. It was perfect. He speaks confidently, almost casually, as though the matter needs no further unpacking. But the follow-up questions continue. The reporters ask what specific part of the body the MRI was meant to examine, why it had been requested, and what results were found. To these questions, the president does not specify details. Instead, he pivots toward emphasis. He explains, we had an MRI and in the machine, the whole process, and it was perfect. He repeats the phrase perfect several times, underscoring that there is no cause for alarm. When asked to elaborate, he replies, you can ask the doctors. In fact, doctors travel with us, but I think they gave you very conclusive results. The president's message is clear. There is no health crisis, no concerning finding, no cause for speculation. He asserts that medical professionals have reviewed the results and confirmed that everything falls within ideal or even above average range. He says, no one has ever given you reports like the ones I gave you, and if I didn't think it was going to be all right, I would tell you. I wouldn't run away. I would do something. But the doctors said these were some of the best reports for my age, some of the best reports they had ever seen. This moment is more than just a response to a simple medical inquiry. It is a scene shaped by political context. At this stage in his presidency, public perception of physical and cognitive stamina carries significant political weight. His administration is preparing for critical engagements abroad, negotiations with Japan, high-stakes discussions in South Korea, and the intensifying conversation on trade and security in the Asia-Pacific region form the core of this trip. In that environment, even a vague mention of advanced medical imaging in an official summary invites speculation. During any presidency, health is not a private matter, but a national concern interpreted through the lens of policy continuity and leadership stability. The president's phrasing, confident, emphatic, and intentionally broad, signals that he wishes to put the matter to rest quickly without lingering over medical details. Yet the tone of press interest suggests that the public desires clarity, not reassurance alone. Questions about transparency in presidential health reporting have a long history in American politics, stretching from Eisenhower's heart attack to more recent debates about routine health disclosures and the limits of privacy for elected leaders. As Air Force One continues toward Tokyo, the president shifts posture, signaling that the matter is closed. The discussion transitions toward the diplomatic goals of the journey. Reporters start preparing their updated stories. Outside the aircraft windows, clouds drift over the vast expanse of the ocean below, uninterrupted and pale under daylight. The significance of this moment lies not only in the medical statement itself, but also in how it is positioned. The president has aligned his remarks with a broader narrative, one of vigor, readiness, and self-assured leadership. In his telling, the MRI results are not merely acceptable, but exemplary. The phrase, some of the best reports for my age, is carefully chosen, conveying superiority rather than mere stability. Moments later, the president descends the steps of Air Force One at Tokyo's Haneda Airport. Cameras capture him adjusting his jacket once more, the characteristic gesture now repeated across headlines and broadcasts. Each motion conveys continuity, control, and message discipline. While this trip is still in its early hours, the geopolitical stakes are clear. Meetings in Japan will center on defense coordination, trade balances, and the future strategic framework of East Asia. The forthcoming agenda in South Korea involves complex negotiations concerning security commitments on the Korean peninsula. Other stops across the region carry their own diplomatic weight, particularly in the context of shifting alliances and leadership perceptions. Every detail matters, from how a handshake is staged to how a sentence is phrased. The president's choice to emphasize the MRI results as perfect reflects an understanding that physical vitality is symbolic power. It is a message to allies reassuring them of consistent engagement. It is a message to rivals indicating continuity of executive control. And it is a message to domestic audiences reminding them of confidence and stamina. Meanwhile, the press pool continues to analyze. Some reporters interpret the statements as straightforward and closing the matter. Others view them as raising new questions. Why call attention to perfection? Why not specify the purpose of the test? How much detail should be expected from presidential medical disclosures? In democratic systems, transparency in leadership health is both a functional necessity and a cultural expectation. Yet it is also shaped by political branding. The president's phrasing mirrors his broader communication style, declarative, repetitive for emphasis, and framed in terms of excellence and superlative assessment. Words like best, perfect, and never seen before are central to the narrative he shapes about himself. From the medical side, the presence of traveling physicians on presidential trips is standard. Their reports, though summarized publicly, are extensive and monitored continuously. A routine MRI can be ordered for many reasons: periodic evaluation, precautionary scanning, or follow-up to a previously noted condition. Without clarification, the public is left to interpret meaning through tone and presentation rather than clinical fact. The president's statement, "If I didn't think it was going to be good either, I would let you know negatively," reinforces his position that there was no attempt to conceal or soften results. He presents the disclosure as open and forthcoming. He suggests that had there been cause for concern, the public would have been informed. The scene on board the aircraft then becomes a moment of narrative framing. Health is not addressed through technical detail, but through performance of confidence. The message becomes less about what the MRI revealed physiologically and more about what it symbolizes politically. As the diplomatic tour progresses, cameras will continue to follow every motion, every expression, every shift in posture and tone. The president steps into meetings where allies scrutinize leadership signals as closely as policy proposals. Negotiations are environments where perception is leverage, and physical appearance, stamina, and vocal tone become part of strategic communication. The echo of his own words, "It was perfect," remains a deliberate refrain. It is designed to close speculation, yet it also invites each audience to interpret the meaning they need to hear. To supporters, it reinforces strength. To critics, it prompts further questions. To international partners, it signals preparedness. The aircraft continues its journey. The press corps prepares their reports. The president moves forward into the diplomatic stage of the visit, and the message he has left behind is unmistakable, some of the best reports they had ever seen.